Good morning, everyone. I'm decided to start now because I know that our speakers also have and a lot of us have very busy schedules. I know that, as I said, I'm going to repeat the housekeeping rules. Please raise your hand. Uh, please keep your microphones muted unless you've been called on to speak. If you have questions or concerns, and if you want to make sure you can also, when our speaker's speaking, you can ask them, but you can also put it in the chat and we'll get back to you with the questions. My name is Deborah Greif. I'm the chairperson of the Brooklyn Family Sports Service Advisory Council. I am also the Brooklyn representative to the Statewide Family Sports Service Advisory Council, which is a subcommittee of the Statewide Developmental Disability Advisory Council. Both of those councils will be meeting next week. The statewide Developmental Disability Advisory Council will be meeting on Tuesday, the 28th of November from 11 to 2. That information is going to be on the website for the Brooklyn Family Sports Service Advisory Council, as well as the Brooklyn Developmental Disabilities Council. We will also have the statewide Family Sports Service Advisory Council will be on next Thursday, November 30th from 11 to 2 or to 2:30. In both councils, you can speak during their public sessions. I would advise you to check both of them out so that if you have concerns or questions, you can let them know. If you're having trouble, you can always email me at the Brooklyn Family Sports Service Advisory Council, which is bfssac@yahoo.com. The Advisory Council's website is www.bfssac.com. The Brooklyn DD Council we have a link for you to go to their website if you choose to. The Brooklyn GD Council will be meeting this Monday from 10 to 12, and they are on Zoom. We are on Ring Central, but they are on Zoom, but we will be working together. The other thing if there's any elected officials or their representatives on, please let us know. Now, if you have any, our minutes are recorded and they are on the YouTube page as well as the transcript, so you can see that on the Advisory Council, as well as the biggest update I'm going to give you all is in reference to what's been going on with the ADM reimbursement. We are still gathering information and totals from what is the issue and problems across the state as well as Brooklyn. I know one issue is that if your child has the waiver, they have a care manager, they will have to be in the if they're in the waiver, you have to make sure your care manager makes sure they do an addendum into their life plan. If you don't have the waiver, you can have it through just straight family support services, a justification letter, and the latest psychological, psychosocial. But we are making sure that the statewide knows, and the statewide family support coordinator is Nick Hobson, and we're discussing to make sure that it's easier also for the families to sign up for whatever type of reimbursements they need with that. And let's see, and we will be having in January, we'll be having at least two, we'll definitely have one of the resource fairs. We're also doing something with the MTA. All those dates will be right now on the Brooklyn Family Sports Service Advisory Council. So now, before we do anything else, does anybody have an announcement they would like to make? Hello, anybody?
I do, Deborah.
Go right ahead, Sandy.
Okay. My name is
Just
Sandy
spoke a
Napier.
drop louder, Sandy.
My name is Sandy Napier. I'm a parent of a child with a young adult with autism, and I'm also with Adapt Community Network. We're having a free webinar this November 30th. That's a week from this Thursday, 10 a.m. to 11:30 a.m. It's going to be the road map to eligibility for services and supports for your family. And it's going to be presented by Kate Gottlieb from ADAPT. We'll be discussing how to submit an application to OPWDD for eligibility. And we'll also be talking about services funded through OPWDD that ADAPT provides. We're going to have Spanish interpretation and Mandarin interpretation. And if you'd like to register, please email familyconnect@adaptcommunitynetwork.org or call 718-436-7979, extension 704. Thanks very much.
Thank you very much, Sandy. I appreciate that announcement. I see we've been joined by Delia Tucker, and also, do we have anybody from OPWD that would like to make an announcement? Or Delia, do you have any updates for OPWD you can make for us? Thank you.
Hi, good morning, everyone. Happy to join you today. Whenever I have a couple of minutes, I really just want to participate and hear what's going on. I believe that there were updates that were provided at the larger meeting. So I didn't prepare anything for today. If anyone has questions, I'm happy to stick around and answer.
Thank you so much. Thank you very, very much, Delia. Appreciate it. As I informed everyone before you got on, this coming Monday is the Brooklyn Developmental Disability Council. They're meeting from 10 to 12 through Zoom. The 28th, the Statewide Developmental Disabilities Advisory Council will be meeting from 11 to 2. And also on Thursday, the Family Support Service Advisory Council statewide meeting will be meeting there too. So I did bring that up and told everyone that the links are on the Brooklyn Family Support Service Advisory Council and also the Brooklyn DD Council. And if you noticed, everyone, you see Christopher standing outside because today they're opening up a new elevator at Park Slope where the F train is at 9th Street. As you can see, he's showing the sign. And he's there because, as you know, he's on the executive board for the New York City Transit Riders Council, as well as he's on what their disability committee called ACTA. They had wanted me there, but I told them, I'm sorry, I can't be in two places at once. I wish sometimes I was Samantha, because then I could snap and make me be in both places, but that can't be. So as you see, Christopher, I know you can hear this, but do you have any announcement you would like to make quickly?
Well, first of all, good morning, everyone. Live from Park Slope, which you now see me where I am, and I'm turning my camera around. As you see, with right behind the elevator, we just finished the press conference 7 minutes ago. We just did a lot of events. You're seeing a lot of representatives, advocates here, and yes, there were some agency advocates who are here as well. So this was a great day to do the press conference, getting it done before the weather. But just to let everyone know that, as Deborah's going to be mentioning it, it's already on our website, that our next Developmental Disability Resource Fair, which does transportation, we're going to be doing that at the Cameron Plaza Library on January 12th. That information is available on our website. You can visit, get the details. We will have 3 divisions of MTA there and discussing how to sign up for the Omni card, or the app, or the credit card. Your choice option is yours. And with Carrie Banks helping us with this at the Brooklyn Public Library, there will be much more surprises coming up in the near future. So some of you have already emailed me. I will be working on that list, see what space we have at this time. But right now, this is where I am right now. And I hope everyone enjoys their Thanksgiving. If you have any questions, please email me later on today. Thank you.
Thank you, Christopher. Also want everybody to know that the next month's meeting, because it's right before Christmas, the Brooklyn Advisory Council, we are joining with instead of doing our meeting on the 19th, we're going to do it on Monday. We're going to jointly join with the Brooklyn DD Council to do it. So we will be with them. I don't have the name of the speaker yet. And by the way, Christopher, as treasurer for the Brooklyn DD Council, do you have the name of the speaker who will be there this Monday at the DD Council? Hello, Chris.
Yes, I didn't hear you.
Okay. Now, who's going to be the speaker this Monday for us?
You're talking about the DD Council speaker?
Yes.
It's the Chief Accessibility in the Governor's Office. Will be there.
Great. So everybody, if you have questions about accessibility, because she represents all forms of disabilities across the state of New York. So this is a major clue that we have her. So she'll be this Monday from 10 to 12, and it's on Zoom. The links are on the website. Thank you for your help, Chris. I appreciate that. Now, is anybody else who's just come on? Good morning, Angela. I see you. Glad you're here. As you know, this council has invited Miss Jennifer Scholes. She is head of the Accessible HRA, and let me get her correct title up. Sorry about that, my dear. Okay. And I'm very happy that she'll be here because she's the executive director of Disabilities Affairs at New York City HRA. I appreciate very much that she's here with her colleagues, because we do have a lot of questions, but they will be doing the PowerPoint. And since nobody else said to me they have any announcements, I'm going to now ask Jennifer and her colleagues to take over. We're sharing, and Jennifer, are you ready?
Yeah, we can do it. Elizabeth, you okay? Elizabeth, we're just down the corner from me. Yeah.
No, it's okay. We have to wait a little bit, we'll wait if we have to.
No, we're good. We're
We're
good.
good. I'm gonna go.
Hi,
ahead and share.
everybody.
Helped tremendously. Thank God I was able to share correctly. If not, we can talk to the man in the beret.
Okay.
All righty. So
Just give me one second.
What does
I'm
it
just
say?
going to share my
I
screen.
think I'm supposed to click OK. Yeah. Okay.
Okay. Let me know if you can see it. I'm gonna just start it.
Oh, goody. I did it right. Yes,
There
I
you
can
go.
see it. I did the sharing correctly. I am going to mute. I'm just going to ask everybody. I know you all have questions, but please write them down or wait till we call. We will also have questions, but to make sure you don't forget, you can also put them in the chat. And I will make sure that Jennifer and her staff get this. So I also want to thank both Jennifer Shaw and Elizabeth Pereira.
Herrera.
I apologize. I'm really happy both of you are here. And now I'm going to mute and ask everybody else to please mute and please give your full attention to our two speakers. Thank you.
Great. And just ensuring that you all can see the full screen, and not a screen with notes or anything like that.
Elizabeth, it's Deborah. I can see everything really clear. I'm very happy
Wonderful.
to say that. Thank you.
Okay.
Jen, do you
Hi,
wanna start?
everybody. Welcome. I see a lot of familiar faces here. So I am Jennifer Scholl. I'm the Executive Director of Disability Affairs for the Department of Social Services. And the Department of Social Services is basically the umbrella organization for both HRA, the Human Resources Administration, and the Department of Homeless Services. And so my small unit, the Office of Disability Affairs, supports both HRA and DHS in their ability to serve people with disabilities. We do three major things, and one is what we're doing here is being a liaison with the community. So if there are challenges with people in the community with disabilities and getting access to our services, we are here to support and enable that connection to be made. The second thing we do is we provide technical support to all our program and supervisors and staff to make sure that they have the tools that they need to serve the population. And we also train and develop training for our staff to understand the needs of the people in the community. I am going to allow Lizbeth to introduce herself.
Wonderful. Thank you so much, Jen. I'm Lizbeth Pereira, as Jen mentioned, and I am the Director of Community Education within the Office of Community Outreach here at New York City Department of Social Services. Our office, the Office of Community Outreach, really works to expand access to agency information and resources for community providers. We do a couple of things here in our office, one of them being provide trainings and education for community providers, other elected officials' offices, and other municipal agencies as well. We, from time to time, also provide trainings and education for clients directly if that's a need. And we also have an outreach services arm in our office that are on the ground in the communities, providing information and access to our different programs and services. And so we're happy to be here and really hope to be a support to any provider organizations that are assisting clients and really doing the work in the communities to support the agency. So thank you for the time today.
Thanks, Lizbeth. We can go to the next slide.
Awesome.
So just an overview of the Human Resources Administration. It's really the organization that provides all benefits, public benefits to the community. We serve over 3 million New Yorkers, and let's go to the actual services, Lizbeth, next slide. Because we want to really, we can make this interactive. It's a small group. Whatever you want to talk about today is fine. We will go over some key things we think are important for you to know right now. But I think what's most important for you all to be aware of is that we provide cash assistance, the SNAP program, Medicaid for people who are in the disability, aged, and blind group. We oversee that Medicaid. The homelessness prevention program, HEAP, is actually really important for your community. And fair fares. What I want to mention about fair fares, and Lizbeth is going to show a little slide later about how you can link the fair fares to your Access-a-Ride. What happens with fair fares is a program similar to the reduced fare MetroCard. If you or your family members or the people you're serving are eligible for the reduced fare MetroCard, they should get the reduced fare MetroCard that has no income limits. They have a disability, they can use the reduced fare MetroCard. That would typically make them ineligible for fair fares. And fair fares is specifically for people within a certain age range, really adults. Can't remember the exact age range, but it's adults of working age who are in a low income group. And how that can benefit people in this community, in the DD community, is if they are using Access-a-Ride, then you can use your fares number to connect it to Access-a-Ride and get reduced fare on Access-a-Ride. Traditionally, they should just be using their reduced fare MetroCard and all other aspects of their travel, but if they are using Access-a-Ride and they meet the criteria for fair fares, they will get reduced fares on Access-a-Ride. Also, ID-NYC is a wonderful opportunity to have an ID, a photo ID, if people don't have a photo ID, but also it gets wonderful benefits to just enjoy the city and get memberships in to go into zoos and to go into museums and to do all that kind of stuff. So it's really a wonderful opportunity for people. We are also responsible for adult protective services and domestic violence services. I think those are the key things I wanted to highlight here. We can answer questions and talk to you about many of these services that you see here, but we're just going to move forward and talk about some key things. Elizabeth, what's the next slide? Okay, so reasonable accommodations at HRA are really related to people having to come into our site for the most part, and the kinds of things that they can get if they come in. So we can have you have shorter wait times if you cannot sustain waiting on site. I see that question, and I will answer that in a question in a second. We can, we say home visits if needed, but right now, because there's no real reason for in-person appointments for almost all of our services, we try and do everything by phone or by computer. So we will work with you closely on arranging those kinds of meetings and things like that. We are going to help you with reading and completing forms. We can provide a sign language interpreter. We can help people who are blind and low vision. So there's all those kinds of things, and you can apply for reasonable accommodation. Next slide. Just by either calling us or filling out the form. The form is available on our website. We're going to give this PowerPoint to the committee to share. Afterwards, we can give it to Chris. Yeah, okay. So we'll give it to you guys to share afterwards, so you have the information about how to apply for a reasonable accommodation. Some things will just automatically be on your case, and some things you will need to provide reasonable accommodation. But at first, you could just request it, and then we will follow up with you if we need any documentation. Next slide. I'm going to turn this over because I know this came up. Deborah had asked me about fair hearings. So I'm going to turn this over to Lizbeth now, and she can talk a little bit about fair hearings.
Sure. Thank you, Jen. Excuse me. So in terms of requesting a fair hearing, so clients or applicants that disagree with any decision on a case have the opportunity to appeal this decision. And you can get sort of assistance with that process. A fair hearing can be requested in a couple of different ways. I know at one point these things were limited, but we've expanded sort of the ability for folks to request a fair hearing should they need it. One is an online request form. So there is an online process. If it is accessible and preferred, folks can make that request that way. There is a way to mail or fax a sort of printable request form. It can be faxed to the number on the screen here, the 518-473-6735, or it can be mailed to the Office of Temporary and Disability Assistance. If folks prefer to work with a paper copy, they're not comfortable with online request form or have access, they can make use of mail or fax. Folks can also request it by telephone. So it can be done via the toll-free number. It's a 1-800 number. And for individuals that live in New York City, which for this audience in particular, if there is a need to request an emergency fair hearing, there is a particular number for these types of requests. This number is only for emergency situations, but it does give you that ability that if something needs to be escalated or it's a little bit more urgent, folks can make that request for a sort of emergency fair hearing at that 1-800 number. And then lastly, there's also in-person. In-person is for New York City and Albany applicants only, so it applies to this audience. But it is in Brooklyn, the Office of Administrative Hearings. If clients feel more comfortable going in person and having making that request there, that continues to be available. But there are also these other methods to for you to avail yourselves to, just depending on what your preference is. So just wanted to ensure that folks knew that these were many of the options that you had, and that at this time fair hearings aren't, you have the option of doing the fair hearing completely over the phone. So we still have the ability of doing that remotely. So individuals don't have to go in person to a center or to the Office of Administrative Hearings in Brooklyn if you, don't want to or can't. Now, just a quick note, the agency will comply with the determination after a fair hearing. If a fair hearing is in favor of the client, the benefits will be reinstated. And this includes any rental subsidies that the client may have been eligible for. If there are any speech or hearing disabled individuals, we have our New York Relay service that folks can access at 711 and request that the operator call the 1877 number to provide that assistance. Jen, not sure if there's any other details in that regard.
No, I think that's great. And I think the next slides, the most important thing I think we need to talk about, the next slides are Access HRA, correct?
Give me one second. My screen is frozen a bit.
Okay, well, while she's doing that, I just want to mention, look, probably we've done so much in the past few years to really make sure that people can reach us and work with us remotely and use their phones, use their computers to contact us instead of the in-person visits. We're really trying to ensure that you have access to us. Having said that, we are very short-staffed right now at our one number, the info line number. And so as much as you can use Access HRA to get the benefits that you need and to get the information you need, I will encourage you to do so. And if you are a family member and you have trouble doing this, if there's a professional that works with you, that would be great. If you are a professional helping the people that you serve in using Access HRA is great, but you can also be a CBO that uses the provider portal, so you can help support through the provider portal and see people's cases that are connected to you. And Elizabeth will go into that right now. So we want to encourage people to use Access HRA as much as possible. I'll hand it back to you, Elizabeth.
Yeah. No, that's right. The platform has, if you've been following Access HRA for some time, you would have noticed that it has grown a lot, and we're really, working hard to expand it and ensure that we can cater to clients that can access it and that prefer to access it. And so I'll go into some of the features and some new developments that are really exciting on Access HRA. So as Jen mentioned, Access HRA is the agency's online benefit portal for New York City residents to apply for different benefits and services. It is a website, but it is also a mobile app, free mobile app, and also a community-based organization portal. Folks are able to get information about their case if they already have active cases or apply for new programs like cash assistance or TANF, SNAP, also known as food stamps, Fair Fares, which is the discounted MetroCard program that Jan mentioned, the Home Energy Assistance Program, HEAP, Medicaid, which is new, and I'll go into that in a little in more detail, and child support. And it really allows folks to both apply and view and manage their case information, and really stay on top of their benefit status, ensure that things are running smoothly and that they're complying with any requirements that the agency may have for them. And so with a focus on our website in particular, on the Access HRA website, clients or applicants can apply for those programs that I mentioned, cash assistance or TANF, emergency assistance, SNAP, HEAP, and Fair Fares NYC. They can also renew or recertify for cash assistance, SNAP, and Fair Fares New York City. Usually, most clients will have to renew or certify once a year, and they can do that via Access HRA. If there's any case changes or if they'd like to close a case, that can also be done on Access HRA. From time to time, different clients for SNAP and cash assistance will have sort of reports that they have to provide to the agency like 6 months in. These are called like a periodic report, for example, for SNAP. That's also available on there. If there is a need for childcare as part of a cash assistance case, a client can request childcare on Access HRA. Any notices that the agency mails to the client, you can choose to also have access to them on there and see them as a PDF, which is handy in case you misplace a notice or you're not getting your mail for some reason. You can sort of see those notices and communications from the agency electronically. Any payments. So as you know, once a month, if you have SNAP, you get your SNAP benefit, and you can see when that's coming and when it was deposited. You can also see your cash assistance case. If you have a cash assistance benefit, you will receive 2 payments per month usually. You may receive payments to help with your rent that goes to your landlord. You'll be able to see those details as to when the payment was made, who it went to, and what your balance is on your EBT card. If there is a need for a budget letter, if you need proof of your benefits or a Medicaid coverage letter, you can request that on Access HRA. And newly, folks can apply and renew for Medicaid. This is particularly for individuals who are 65 and over or who have a disability, whose Medicaid is managed through HRA. Folks can apply or renew their Medicaid now directly on Access HRA, which is very new and exciting a development and feature. I would say it's about a month and a half old now. So certainly, for those that can take advantage, we encourage it. Now, part of Access HRA, as I mentioned, that was sort of the website and what the features that are available on there. But we also have a mobile app. It is a public-facing mobile app, just like the many other apps that folks may have on their Androids or iPhones. It is completely free. While you cannot apply for benefits on the app directly, you can use it as a sort of case management. You can read messages and notice, as I mentioned. You can view details of your case, so like the status, if my case open, closed, what my balance is on my EBT card, again, any payments that have come in or are coming up, any appointments that you may have or requirements such as documents or interviews. And most importantly, I would say with the mobile app is the ability to upload documents. So if the agency needs you to return documents after you've applied or recertified, you can easily log into your mobile app and either take a photo of the document, or if you already have it saved on your camera roll, you can upload it. Now, unfortunately, you cannot do that on our website, so you can't submit documents via the website, but you can do so via the app. And of course, you can still do it in person if you'd like at a Benefit Access Center via fax or via mail. The mobile app is just the quickest way to do this, but we understand, not everyone may want to or is able to. So those other means of submission are available still, but this is just a way that's sort of quick and can be easy for those that are comfortable with a mobile device. We also have another app, and this is a NYCHRA document upload app. And the reason why we have sort of these two apps, or the ways in which they are different, is the previous app that I mentioned is sort of tied to Access HRA and requires a client to log in to their Access HRA account. So you put in your username, your password, and log into your account and be able to do those things that I mentioned. The NYC HRA document upload app is designed for both clients and their representatives to upload documents. And the way that it sort of serves this population, it's that there is no need to sign in or create an account. So if you're working with a provider that maybe doesn't, have your credentials, or maybe you've forgotten your, username and password, you can use this mobile app to submit and upload documents without needing to sign in or create an account. You'll just have to verify some personal details like a case number or your Access HRA confirmation number, or a client identification number, also known as a SIN, and select the type of document that you're looking to upload, and go ahead and submit. So this takes away that sort of need to provide credentials. If you're working with a representative, or if you're working with a family member, or if you just can't get into the other app, you can certainly use a document upload app to submit documents. So there are sort of two options here. Now, I want to just give you a bit of a glimpse as to what the portal sort of looks like, the website, the Access HRA website for a client. So I'll go through these sort of briefly. And again, if there are certainly if there are questions, we have time to go over those. So this is what the homepage looks like on Access HRA. It is nyc.gov/Access HRA. So there is a what's new section, which is kept pretty updated. There's a lot of good information on there as to any kind of changes or updates pertaining Access HRA and also just the agency as a whole. There is the Apply Now login button. So here you will select this button if you are looking to apply or log in. This is for clients that already have an Access HRA account. On the bottom, there's a Create an Account option. And creating an account is very simple. Just need a username and password. You don't need an email, and you can create your account there and go ahead and apply. If you already have credentials, you would just log in to view your case. There is the ability to select the language here at the top. If you say you select Spanish, this will convert the entire website into the Spanish language, and that selection will follow you through as you interact with the website. So that language choice will remain on there. We have some kind of resources here on the main page as well. There are some user guides, some links to helpful resources. There's a link to our office locations. There's some good instructional videos for clients and providers alike. So it's just a really handy web page, homepage to provide some guidance here. And as I mentioned regarding creating an account, it's relatively simple in terms of the amount of information that it asks for from the client. So email address or username. We understand that not everyone has an email address. Not everyone wants to create an email address. It can be cumbersome. So certainly a username of your choice is completely okay. There's a password requirement, and then there is it will ask for a sort of security question. It can be something simple as, what was the name of the street that you lived in when you were a child? Anything like you're comfortable with can provide it, and something that's easy to remember. And once you are in Access HRA, and this is for an example of someone with an active case, just to kind of show you the things that you'll be able to sort of see when you log in if you have a case. As you'll see here on the top, there's a dashboard that will have some information about any expiring cases. If you have an e-notice from the agency, you can click that and view that. Any required documents, you will have sort of this notification at the top that will say, you can sort of click on view documents and see what those required documents are. In the center here, you can see your cases. So you can see if it's active or if it's not active, if it's expiring soon, if you have any like appointments or interviews coming up, when your next recertification is due. And you can view more details on here. Any recent notifications that we've sent can be seen towards the bottom. And then on the right-hand side, there are a lot of different quick links where you have a kind of to-do list. There's also the payments section here where you can see the next payment coming up and the payment type and the date for the payment. And you can view more payments if you select that link. So really handy webpage, a lot of information here. And I think that it's just really useful to be able to sort of see the universe of options as a client on Access HRA. Okay, so we wanted to take a few minutes to discuss Medicaid on Access HRA. So this is a new feature, a very exciting feature, one that folks have been sort of asking about a lot ever since we launched. We've had SNAP, we've had cash assistance, newly fair fares, HEAP, and Medicaid just made sense as the next step. And again, this is Medicaid for individuals whose Medicaid cases are managed and administered here at HRA versus the New York State of Health. So most clients with disabilities, including blindness, are age 65 or older, or who need sort of waiver services, can apply or renew on Access HRA. There, we'll see it in a little bit, but when you come on Access HRA and attempt to apply for Medicaid, there'll be some questions just to provide guidance to the client as to where they should be applying, if Access HRA is the right place for them, or if they need to go, for example, to the New York State of Health, or if they are in an institution, potentially they would need to discuss this with an admin there who can help them apply individually. But there is a very helpful tool to sort of provide guidance. So these are the type of information that you'll see with a Medicaid case. So this screen looks pretty similar to the screen that we just saw for example, a cash assistance client, but has different and additional information for Medicaid. So you will see, for example, at the top here, a case number. There will be coverage status, when the next recertification or eligibility end date is. If the client has a surplus amount, you'll be able to see that. This only applies to some clients. There'll be a renewal alert. As you can see here, it'll say your renewal is due soon and a link to complete that renewal. Your contact information, so head of case, date of birth, mailing address, other associated address, and these are all things that you can edit and change. The case members, if there is more than one individual on the case, and it'll have the status, it'll have the SIN number, the coverage date, etc. And then some helpful tools on the right side. If you need to request a coverage letter, that option is there. If you need any more help, there are some good definitions here in the event that a client just needs some guidance as to what things mean when we say what is a recertification due date. So it has those details on there for the client. And if a client, again, has a surplus amount and they need to make a payment, there is a link for that as well. So this is the Medicaid pre-application screener that I mentioned. Because we have different populations of Medicaid clients whom need to apply on different platforms or via different agencies, we want to ensure that when clients come on Access HRA, they are at where they need to be. We don't want folks to complete an application and this not be the right place for them. And so the first step when you attempt to apply, it will be sort of a questionnaire of sorts to ensure that you are where you need to be. And if Access HRA is not right for you, we will let you know where you should go to apply. And so just noting here the question. So are you applying for yourself? Are you age 65 or older or have a disability, a certified disability? Are you looking for particular coverage? Are you, for example, at a nursing facility? Things like that. Once you answer these questions, the system will let you know, great, you're in the right place. You can go ahead, continue your application on Access HRA, or if not, you may need to go to the New York State of Health or may need to go, discuss this with an administrator at a facility to apply for these benefits. And want to make a note that this Medicaid application, folks that complete the Medicaid application and apply for Medicaid will also be assessed for the Medicare Savings Program. So you don't have to complete a second application. You don't have to apply it separately. This one application will sort of work as a two-in-one for clients, if, of course, they are eligible for Medicare Savings Program and are interested. And this is just a little bit of what the application looks like. You'll apply for Medicaid, provide household information, provide income information, information about any resources, information about any other health insurance that you may already have. There'll be a Supplement A resources form that's already included in here. So you don't usually, a client would have to complete this form separately, but it's all sort of embedded in the application. There's a financial maintenance form in the event that we have a client whose income is not meeting their expenses. And then we have your confirmation and documents. The application is step one of things. Clients also have to return certain documents to the agency, but the agency will communicate exactly what we need from the client. We'll just show you sort of this screen here to give you just an example of things that you may need to provide. And again, as I mentioned, the Medicare Savings Program, the application for it is included in this Medicaid application. So folks can apply for Medicaid and just be assessed for sort of both. And eligibility will be determined based on the information that clients provided. And for those that may not know, the Medicare Savings Program provides assistance for clients that have Medicare to assist them in paying those premiums that they are responsible for. For renewal, looks very much similar in terms of the type of information that we collect. For the most part, Medicaid clients will have to renew once per year. A lot of the information will be sort of pre-populated, but if there are any changes, this is the opportunity for a client to provide it. But it looks the same in terms of the flow and the type of information that we request from the client, and can be done on Access HRA directly as well. And clients will receive a notice letting them know that this is coming up, and they'll also see a lot of notifications and alerts on Access HRA informing them that their renewal is coming up and that they have to submit it. And similarly, this is what it looks like when you complete your submission. You have a confirmation here and documents that are required for the client to complete the entire application. Okay, I know Jen, I'm going to move on a bit to from Medicaid to Fair Fares. Jen mentioned information on Fair Fares already earlier, but we wanted to just provide a little bit more detail as it pertains to this benefit for New Yorkers. So, as Jen mentioned, New York City residents can receive a 50% discount on subway and eligible bus fares. This also includes Access-a-Ride paratransit trips. The Metro card doesn't come preloaded, but it has the benefit sort of embedded in it, meaning if you go onto a sort of transit machine, select, you want to maybe add $50 on this, what you'll have to pay will be $25. Or if you are buying a 30-day monthly unlimited ride, it's $100 and something, you will just pay for half. It's available for the weekly, for the 30-day, and for single sort of rides or specific dollar amounts. Jen mentioned that these applications are open to eligible New Yorkers. Wanted to note that the ages are 18 through 64, and individuals that are at or below 120% of the federal poverty level. One thing to note is that the income eligibility threshold has increased. So it used to be 100% of the federal poverty level. So now more New Yorkers may be eligible for this benefit, as there's been an increase in that income threshold for applicants. And particularly, those who don't have a discounted transportation from the MTA or the city already. For example, some high school students may already have a student Metro card, so those students won't, be eligible for this benefit. But wanted to make a note, and Jen, I think you mentioned this earlier, but and if you'd like to expand on it, by all means, if individuals meet that Fair Fares eligibility criteria, they may be eligible for the Fair Fares and NYC discount on Access-a-Ride fares, even if they're already enrolled in the MTA reduced fare program for persons with disability, or have an Access-a-Ride Metro card. So certainly can avail themselves to this additional benefit. Fair Fares is available on Access HRA as well, and folks can upload documents to support their application or their renewals on the app. But again, fax, mail, in person are also options. If Access HRA, is not feasible, 311 is also available. If folks need to, for example, report a lost card or a stolen card or a damaged card, this request can be made on Access HRA, but 311 is also an option for folks to call in and report that card as lost, stolen, or damaged.
I'll just add, go ahead.
No,
Elizabeth,
go
I
ahead.
didn't realize
Just
you had another
mentioning that
bullet.
we do have those in-person locations for Fair Fares, and similar to other benefit access centers, they are open Monday through Friday, 8:30 to 5, closed on holidays, but that is another option. If phone or online is not an option, folks can walk into a Fair Fares location for assistance.
Excuse me, this is Deborah. I'm going to use chairman privilege. They still not have raised the level for access right for 65 and above, because it's $2.90 and till 64. income wise, I probably could have, but it's $1.45. But a lot of us seniors who also are in a low income don't understand why they've not. We're not blaming you because you did not set it up, but why didn't they think to keep that level up? Because then most people who are seniors who get accessorized are in a low income level. Do you know why?
Yeah, this has come up many, many times, Deborah, and I completely understand. And uh, honestly, the Fair Fares program was specifically designed for working age people. And the Fair Fares program was not initially intended to have anything to do with people with disabilities or people who are aging. But
Mhm.
as people advocated, we were able to open it up to people who were using Access-a-Ride who were in that category, so that they could use Fair Fares in that capacity. They're not using it in any other capacity, but they're using it in this capacity. So Fair Fares has a very limited scope. What we've encouraged people to do is to work with the MTA to see if they can expand the half fare MetroCard to be used for everyone else on Access-a-Ride. So I completely understand what you're saying.
Yes, I did, and I did talk with the MTA,
Mhm.
and they're trying to figure that out too, because they don't go by income levels for us. They go by,
Right.
what is your
Right.
qualifying disability? So the only thing I may have to do is just tell everybody, ask us and let us to the mayor's office as well as the governor and chief accessibility too, because maybe they can figure out what they can do to help. Because I get, you don't know how many calls, Christopher and I, emails and texts we get. I can't afford. Why aren't they letting it go 65 and above? And we
Mhm.
did ask them at the MJ, and they said they're looking into it, but there's a lot of technicalities. That piece I know. So
Yes,
I just
there
want
are.
you to know that we have tried and we are trying to advocate. But if you think of other ways that we can advocate, that we may be able to make a change to help our low income seniors have the accessory Fair Fares goes up higher, I mean, age wise, please let me know. But thank you for answering. I appreciate it. Thank you. And sorry to
Yeah, I
interrupt.
appreciate the question. I will say it is the way to get your Fair Fares application connected to the Access-a-Ride is to go on the Access HRA app. It will lead you to those questions, so you won't end up eligible for fares in general. You'll be ending up eligible for Fair Fares as it pertains to Access-a-Ride. It will walk you through the questions. You'll have to have your Fair Fares number and information handy, so you put it in, and within, I think, even just a few days, there's a matchup directly with Access-a-Ride, and it will then kick in on Access-a-Ride, and you don't have to have a card or anything. It is on the Fair Fares. The bus drivers will know, the Access-a-Ride drivers will know that you only have to pay half fare based on their roster for the day. So you don't have to do anything more.
But it's not if you're 65 and above, correct?
Not if you're 60. Yes, I'm talking about the people that would be eligible for Fair Fares through the income and age, and you go through that process and Access HRA. You won't get eligibility for all of Fair Fares, but you will get eligibility through just for Access-a-Ride. So you got to go on Access HRA and do it, but just have your Access-a-Ride information handy so that it will all link up.
Okay. Well, I'll be advocating for people 65 and above too.
I understand.
But I want everyone to know Jennifer and Lauren, they did not set this program up. It was set up under the de Blasio administration. So I want everybody to know that we just will have to advocate in a different way and not blame. And I appreciate Jennifer and both of you to explain how to do this. So thank you. And now please continue.
I'll hand
Thank
it
you.
back over to Elizabeth.
All right. I know we have a few providers here in this meeting on this call. So wanted to just spend a few minutes just shining a little bit of a light on the provider portal, which is sort of the third aspect of Access HRA, if you will. This is a different website, but still lives within the sort of Access HRA family. And it is a provider-facing website, so not for clients, but for community-based organizations or any sort of organization that's assisting clients and providing some sort of case management. So the way that the provider portal works, it is a CBO provider portal. Clients on their Access HRA accounts can provide grant access and grant consent to your organization to be able to view their information. And so essentially what you'll be able to see on your end is client information for folks that have provided your particular organization consent to view their benefit information. It'll provide real-time case information for individual clients. You can view notices that we've sent to them. You can see their case status, if it's active or not. You can see any sort of documents or interviews that they may be required to comply with, any upcoming case actions. And I'll sort of just go into quickly what this looks like for the client. So on the client's Access HRA account, as we sort of went over a few minutes ago, they'll be able to connect to your organization. So they can select this option, get started. And what they'll do is they will enter, if you are a provider portal member, you will have a site ID, a sort of a 4-digit code that clients can enter on this step of the process here on the second screen, and search for your organization. So they'll type in 1234, for example, search will get the result for your organization and select your organization. And then they will have to sort of provide their signature, initial here and date, essentially agreeing to provide your organization with permissions to view their information for both SNAP, cash, and Medicaid, as you'll see here. And once they grant your organization permission, you will be able to sort of see their information on the provider portal end. Clients are allowed to give permission to up to 5 organizations. So, we know clients in the community are often working with different organizations for support, and so they're able to provide access to up to 5. And you will have access to their information for up to 18 months. The client will have to renew that access and those permissions, and the system will sort of flag that for them. If they don't, then they will just sort of drop from the roster of clients that you'll have on the provider portal. As you'll see here, there is a renew option. They can always view the authorization or remove access. Say they're working with a provider for now, but next year they are no longer, or they've moved, or they're no longer seeking those services. They can remove access if they choose to. And just a quick recap on the Access HRA sort of functionalities here. We have our client-facing website, nyc.gov/accesshra. We have our mobile app, the Access HRA mobile app, and also the New York City HRA Upload app. And we have the provider portal, which is for community-based organizations and providers to assist clients with case management. And if there are any interested providers here with us today that are not part of the provider portal but are interested in learning more, I will certainly have my contact information at the end, and you can reach out to me and we can discuss getting you access. It's a relatively simple process, but I think very handy for folks that are doing this type of benefit access work. Okay, just a bit on some resources for support for you all. Want to start with Access HRA. So for anyone that has experienced technical issues with Access HRA, which as an online platform, this does happen. There is a contact us button at the bottom of all Access HRA pages, and you can use that to send a message to the Access HRA help desk. folks, providers and clients alike, can email the Access HRA Help Desk directly if they have general questions about Access HRA functionalities and features, or if there's a technical issue. There are two different inboxes on here. In the message, we have some sort of instructions here to please include a screenshot of the error that the client is seeing, a description of it, and the Access HRA username so that they're able to sort of pinpoint where things may be going wrong. This help desk is not for case information or case status or pending applications. The Access HRA help desk cannot provide that type of information. It is really for sort of Access HRA functionality questions and technical issues. I've also included a link here to the Access HRA user guide, which has a lot of great screenshots and really goes into detail on Access HRA functionalities and features. That's, I think, just really handy for clients and providers alike. And now for contacting HRA. So outside of Access HRA, in the event that a client or provider is looking for support pertaining just any of our programs, if there are any questions or any case issues. So we have here HRA's one number, which is our sort of general hotline. As Jen mentioned, like hotlines, there can be sometimes a long wait on here. And so, as much as possible, if the client is able or the provider is able to interact with our online tools. But, we also understand that sometimes you just need to talk to someone on the phone, and this is for that purpose. There's the 718 number. If there are Medicaid inquiries, we have a Medicaid helpline, which is separate from the one number. We have the email address here for reasonable accommodations requests or case inquiries or filing complaints. It's constituent affairs at dss.nyc.gov. For disability affairs assistance, this is Jen's team. We have disability affairs at dss.nyc.gov. Super helpful group. I can say that from experience. And then for sort of general HRA or DHS questions related to any changes related to programmatic changes or trainings or any outreach requests that folks may have, or if you just don't know where to go, right? Sometimes there are a lot of different phone numbers and email addresses, and sometimes you don't know what the right one is. This is sort of a good general inbox for that type of kind of triage and guidance, and it's DSS outreach at dss.nyc.gov. So if all else sort of fails, this is an inbox that's monitored 9 to 5 Monday through Friday. A great team of folks that would certainly work hard to at least try to figure out what you need and who can assist.
Okay, thank you so much, Lisbeth. You've been amazing always, as always. Lisbeth and her colleagues do a lot of these trainings in the community and a lot of presentations in the community. If your agencies need help with that, you can reach out to Lisbeth, and you have my contact information as well. For general case stuff, I do appreciate if you do reach out to Disability Affairs, because there will always be somebody monitoring that mailbox. So that makes it easier. Before we just open this up, because I'm happy, both Lisbeth and I are happy to talk about any of the things we've mentioned today or any other questions you have about HRA or even about DHS. But I wanted to mention one other thing, because I see that there are a lot of professionals on the call right now. There is a program we started about 5 years ago called the Partnership for Inclusive Internships. And it's a collaboration. It's grant funded through a foundation, but it's a partnership with AHRC NYC to provide internships for people with disabilities in government. And it started with our agency and it continues with our agency, but it's expanded to other city agencies and state agencies that are located in New York City. Over 160 interns have come through, and they have all different disabilities, not limited to developmental disabilities. There are people with sensory disabilities, there are people with physical disabilities, there are people with health disabilities, people with psychiatric disabilities. And it's been a very, very successful program. If you're interested, if you have candidates, it's all adults, all ages, but adults, who you think would be good candidates who are interested in working in any aspect of government. There's very high level positions, and some basic, data entry positions or filing, indexing, things like that. There's a wide range of opportunities available right now. So if you're interested in referring people, contact us, contact me directly, and I will get you connected to the people that are coordinating that program. Because we're expanding so quickly and there's so many agencies that are interested in interns, we are always looking for partners that can provide candidates that are appropriate for these positions. So I just wanted to mention that as well. And then we can just open it up, whatever you would like
Jennifer,
to find out about or talk about.
It's Deborah. For anybody else, because I just also want to personally thank both of you. I appreciate. But I'm really glad you mentioned certain things. You see, one of the issues a lot of my families have brought up, but also the reason you see a lot of professionals here is that we have a lot of families who English is not their first language. So what I've said to the professionals, please come in, because the families could be linked to them and they're telling them in their language or dialect. So that's why, because it's not easy to get translation. So I'm trying to.
I feel really guilty because I I asked Elizabeth to remove the language access slide.
It's okay.
So
it's quite all right. Don't feel bad.
we will add it back when we give you
Yes, we will put. What we're going to do is also, Chris. I won't do this because I refuse to mess up it. Chris will know how to separate it to do to make sure it's highlighted very well. But no, that's okay. But one thing I appreciate is that you mentioned about the New York State, where they pay for the Part A and B because the child gets Medicare because either parent became disabled, retired, or sadly passed away. I have had a lot of, now they're called care managers, have sent the families to do the spend down. And then these parents are in credit card debt, and I said you didn't have to be. Yes, I know Maria Ortiz Casada has been wonderful. She's helped, but I appreciate also that you're bringing that up, because that's a very important issue. And everyone's understand that because our children have to be diagnosed in this population before the age of 22. And you know what I'm saying, Jennifer, because in your previous life, you were at another agency, but you understand the piece I'm saying. Because I get the parents, I feel guilty, I'll get everybody in trouble. They're not getting anybody in trouble. There was a mistake. It has to be rectified. That's why there's erasers on pencils. But everyone needs to remember that. I did that because thankfully my child and my sibling are DACs, or adult child survivors, so that helps. So I want to thank you for bringing that up. The thing is though, because I was having a little brief, if you're the rep payee for it has the app, your HRA app has been updated, so a rep payee can fill the form out for the individual who has to either get HRA, Medicaid, SNAP, or other benefits.
Can you say that question one more time?
Okay, if I'm the representative payee, especially say it's for my child or another individual who's asked me to do it for them, will I have problem on the HRA app filling out the forms for them? Because on the paper form, I just put my name, address, and make a copy of my ID to be attached to the paper form. But this is an app. So did they finally fix that so I can, if you understand what I'm saying, take care to do it the right way? Is it being done?
So I know the answer for SNAP, but I think Lisbeth knows more. So I'm just going to let Lisbeth answer.
Is it for a particular benefit or just in general? Or for
Well,
Medicaid?
It's both. But if you're the representative payee, you're supposed to be the one you're the one who's in charge of their bill paying. You're in charge, and this whole population.
So with SNAP, for example, when you complete the application online, you will reach a point in the application where you can enter information as an authorized representative. And so there's a particular form that you will enter your information in and complete the application, and that will attach sort of your identity as someone who is representative of this client. For Medicaid, there is also one for the same in the same sort of flow. So before you end the application, it'll say is someone assisting you or someone assisting this client, and you'll be able to enter the information as a representative. For cash assistance, it does not exist in the flow of Access HRA. However, so it's not on there, but you can submit a written request to be named as the authorized representative for a client, and you can submit that as you would submit any kind of document requirement, so you can upload it, but there's no form for cash assistance. So if you pull up an authorized representative, it's going to say SNAP on it, and the Medicaid one is particularly for Medicaid when you're doing a Medicaid application. But for cash, you can still be an authorized representative for cash. There is just no form, but you can, or the client can submit a written request to say, hey, I'd like, I'm assigning sort of Lisbeth as my authorized representative, and she should be able to do X, Y, and Z on my behalf.
Thank you.
And
Appreciate
I
it.
unfortunately don't have, Jen, I don't know if you know why for cash there is no form, or why can't we use just one form for all? I'm sure there are some
I don't
intricacies
know.
behind that, but
It's very complicated. All I remember is these conversations took place, and they were very
Yeah.
complicated conversations.
Well, thank
But-
God.
I
at
think
least-
there are federal and state rules about some of this stuff, and they're different for each benefit, and so that's part of the issue.
Yes, it is, and but there are times when I tried in other accounts we've tried to do our kids stuff, and it rejects us. So that's why we're asking: is everything been updated? Because I would, if I can do it online, I'll do it. If not, I will show up to the office. Usually, when I'm there, they go, "Oh my God, she's arrogant." No, I'm not. I don't fight with them. They go, "Oh, it's her again," because I get thank God she fills the forms out right and brings all the correct paperwork. I tell everybody, and I'm going to say this for everybody, and whether you're a professional parent, it's better to have more paperwork and more things so when they ask, you don't have to come back. Because then they'll give you this big list and you have to bring it back within the amount of days. So do what I do. Be over obsessive and make copies of everything and hand them everything and let them decide what they want. And then, because I don't have to go back. That's why when I come in the office, they go, "Oh, it's her again. Thank God." It's a nice thing.
You make a good point about the copies. I really will encourage everybody to make a copy of everything that they submit and everything that they get. Somebody sent me something recently. She says, "No, I have a video of me mailing the document." I go, "But did you make a copy of the document?" And she didn't. I go, "The video doesn't really help us. We really need the document." So absolutely make a copy of everything if you can.
Oh, I do.
Even if it's taking a picture of it.
Oh, I do. I've done that, but that's why I'm really glad you're saying that. Both of you are saying that, because to me it's extremely important, and they don't understand. Because if you ever have to go to the fair hearing, they're going to ask you for your proof, and because like me, I've taken to hand it over to the judge, and the lawyers are going through it, and then they go, "Up, case dismissed," because I did that. I did submit it. Yes, it's a pain in the neck to have all these papers, but trust me, not having to go back and stand on the lines and everything, it's a lot better. If you ladies, I hope you understand what I'm saying, because even when I show up at the fair hearing office, I'm always greeted nicely, because if they say, "Oh, good, at least she has paperwork." It's pain. I understand that. And none of us like all this paper, but this is for our children. We have to protect them. So that's why I bring it up.
Best interest.
Anybody else have any questions for these two ladies? Feel free to ask. Go ahead. Raise your hand. Let's see.
And if folks think of things later, we're always here for support. So if
Sandy
anyone sends you
Naper.
any questions.
Okay, Sandy, unmute, dear.
I'm unmuting.
We can hear you. Go ahead, girl. Unmute yourself again. You remuted yourself.
How do you link the Fair cards with Accessoride?
Okay. So in the Fares application, as you go through, they're going to ask you some questions and they're going to ask you if you use Accessoride, right? And once you say that, they're going to ask you a number of questions. And that's why I say have your Fares information, and everything needs to match. So you have to have your Fares number and your name as it appears on your Fares card. And then on the back end, we do a match with Accessoride. So that's how you just go on Access HRA, go in the Fares section, start filling it out, and just the questions will take you to that section. Okay.
Okay, my son has a Fair card, but I didn't link it with Accessoride. Can I do it now, even though he has the card now?
Yes. Yes, you can. But how old is your son?
My son is 27.
Okay, so he should, if he has a disability, he really should be using his Fair card. And really it's about using Accessoride for the Fares part of it. But yes, go back in and you can get it connected. If you go back onto Fares.
Am I able to share my screen just to show what it would look like really quickly?
So yeah, I think you already had the ability to share your screen. So can you reshare?
I never unstopped it.
Okay.
Yeah, I should be able to. Just give me 1 second.
All
Right, let me know if you can see it.
Oh, it's coming up. It's coming
There
up.
you go.
There we go. We can see it now.
So if you're here
Ah.
on your Fares
Can you see it, Sandy?
NYC, there's a update Accessoride information under quick links. Then it will bring this up. If you are enrolled in Accessoride, check here, and you will enter that Accessoride ID on here, the number in the front of the card or letter, and then you will kind of confirm that you would like to apply the Fares NYC discount to a MetroCard for, instead, etc. And this is for sort of removing that, but here you can enter the Accessoride ID, and again, it's under sort of the quick links on the right-hand side here.
Great, thank you so much.
Of course.
Freddie, you know what? I'm going to ask Elizabeth, when we send the PowerPoint, can we add that slide?
Yes.
Yeah, let's add that slide. We'll add the language access, and we'll add that slide when we send you the PowerPoint. Thank you,
Thank
Elizabeth.
you.
I'm so glad you have access to that.
And yes, Sandy, don't worry. You'll see it. I'll make sure you get it. Any other questions, Sandy? Because your hand's still up. Okay, well, any other questions, my dear? Oh, well, well, no, she doesn't have any more. I have a question. When you become a senior, can you do a quick, maybe explain why income threshold levels are higher for seniors than the other part of the either under 60?
For Medicaid?
For any of the benefits, because see, when you have a senior in the house, I mean, it's my household. When my mother turned 60, she got her SNAP benefits, and all of a sudden, my son and I it was just us two when he was under 18, and all of a sudden, we got more SNAP, but she also got more SNAP. But she turned 60. What is the criteria for the seniors? Or you don't know?
That likely was not due to age. There is no difference in
because they told me that once you have a senior living in your apartment, or then income levels are different for them and totally different for the other house. They take them out of your household. Been happening.
Having a member with a disability does make a difference. I'm not aware of.
Yeah.
But
we can maybe.
But we're not the absolute experts. So.
Yeah.
Okay. Not only because I've been questioned by a lot of people, but I know because this happened years ago when Christopher was under 18. So it's not a new thing. It's been on that way for a very, very long time. And now they make it easier for the seniors to get the help. even if they have a disability or they're the parent of a child with disability, so maybe you knew about the criteria. But
We
just
can
ask.
ask SNAP about that.
Because also SNAP also she was able then to get her own Medicaid. Everything changed all of a sudden, changed the household.
Deborah, I'm going to tell you that all of these benefits are incredibly complicated.
Yes, they are.
And so, but neither me or Elizabeth have the level of detail on any given one. We have really good general information. We don't have the level of detail on any given area. So we can check with SNAP
You
about
both
that.
explained the general information very well. So it is now, in fact, some of my members of my advisory council who are on here are able to understand, because I'm being tech great. I now understand more. I know what to do. You know, that's a big thing. You just broke it down and made it very simple. And it's something when you just do direct, simple, basic, people can catch on. Because we as parents are very overwhelmed with all what goes through with that children. So that's why I wanted to tell you, yes, it was simple. Yes, but you still brought it to a point that everybody here understood. And that's appreciated. I'm appreciating because now I don't have to explain everything. I need to read it there. So, by the way, does anybody else have questions, or are there any questions on the chat? Are you still sharing? Because I'm having trouble reading them.
No, she's not
I'm
still
not
sharing.
But we'll include that
Okay,
screenshot
I'll
for the
check to see. I'm here, chat. Let's hope I can see this. That's only a bit. Doris Kahn. She did her okay. No, well, we have, all right. That was it. She didn't ask a question, but if they did, I don't see it now.
Okay.
Nobody else has any questions for Jennifer or Elizabeth? Nothing? Okay, I'll give everybody one chance more. Alrighty.
Doris turned on her camera. Doris has a question.
Oh, hi, Doris. Please go ahead, unmute.
It's not a question. You guys did such a good job of giving the overview and explaining that we don't have questions. And yes, there will be questions that are individual specific. So you gave us the contact numbers to call.
Great.
And hopefully we won't have a long wait to getting a response. But thank you very much.
I just want to say, Doris, I saw your notes in the chat, and I want to say, please say hi to, there's a lot of good people in there. I want to say hi to Liz Sunshine. And I didn't know that Juliet was with you now. So say hi to Juliet for me too, to Liz and Juliet. I used to work with Juliet for many, many years. So
they have a great gem that their agencies don't. No, I'm not favoring anybody. No, they work very well, and we appreciate everything that they do for us.
And Liz really, really helped me on a DHS case a few years ago. Really, really was wonderful, and I appreciate that support. So
yes.
Thank you.
We will thank you. Thank you, Doris. Oh, Doris, while I'm having you here, why don't you just announce? I know you usually like to do your announcement. Please announce what openings and things you have with your program.
I'll just be short because we're holiday season and kids will be off from school. I just want to encourage everyone to fill out applications for our recreational outings. We have tickets to various events and sites in the city, and you have to, of course, live at home. You have to be OPWDD eligible, and you have to live within New York City. So, actually, for our recreational outings, it's only Brooklyn, Queens, and Staten Island and the Bronx, not Manhattan. So I wanted to mention that. We also provide free transportation to go to these outings. So please take note, families, to call the contact numbers I put in the chat or email us for more information and fill out those applications. Thank you.
Doris, do they have to be in the waiver?
No.
Okay. Okay, we
Thank
might have some
you.
people in shelter that would really appreciate those outings.
1 second. They have to live at home.
And they're living with their families at home in shelter, but it's different for the waiver, but for family support services, they could get them because they're living with their family in shelter. So
I would have to, if I could check that out and get back to you.
Please
I have
do.
your email address because I don't want to say yes universally because grants
yeah,
are very
please do. Yeah,
grant specific, and I don't want to say offhand. I know
yeah,
individuals have to be living at home.
yeah.
Okay.
Oh,
I'll
look
get
who
back.
just is coming in. Let me get her in, Robin. She can answer this too. She'll be on in a second. Let's ask her. Hello, Robin Mooney. Glad you made it. We have a question that maybe you can help us. So you can unmute. Are you there, Robin? Can you hear me? You just have to unmute your mic.
Yes, I could hear you.
Okay.
Bye.
Robin Mooney, I'm going to ask Jennifer Scholl to answer the question, and because both Doris Kahn from NYSED, we're not sure. Okay, you ready? Go ahead, Jennifer, ask her.
Sure, Robin. We understand the issues with people living in shelter receiving waiver services, but for family support services, if it's a family living in shelter, but it's a family living in their own space together, my understanding has been that they can get family support services. We just wanted to confirm if that's the case.
I actually am waiting for, I'm going to be reaching out to Nick and Amy because I am not sure. We have never had that happen before. This would be the first time someone is requesting that. Are they requesting some? Actually, when I did ask them, and they said they would need a specific reason or what is that service they're actually looking for within family.
It's a family support service.
And nobody gave me an answer on that. So
No, like tickets
it
to
has
an
to be
outing.
something. They're asking for specific tickets to an outing. Okay, I could ask about that.
Yeah, and I've already we've had
Like
other
sports and
opportunities.
recreation. You talking about like sports and recreation tickets? Sports and recreation type of tickets through NYSED you're talking about?
Yeah,
Yes.
NYSED
Yes.
recreation, right. Right now we
Okay.
have tickets to the Apple Circus,
ask.
everybody. For
We've
Reserve
already
City.
accessed family reimbursement
Nice.
services and parent training services. Things that are not waiverized should not be an issue as far as my understanding is. It's not a
And
waiver
for
service.
people in a homeless shelter you're talking about, right?
Yeah, these
Yes.
are families.
People in a homeless shelter?
Mhm.
Okay, I'll find out. They're living with their family in the shelter, though, correct? They're not
Exactly.
by themselves.
In their own units.
Okay.
Some of them for years. It
Wow. And they're eligible. They're already someone who's OPWD eligible.
Well, yeah,
correct?
this is why I do know some families that might benefit from the NYSED program, and personally, I feel like we really should challenge the feds on this because to help stabilize families and individuals who are living in shelter, they need those waiver services, and I really feel like we should be advocating that people in shelter are considered living in the community. But for family support services, I don't believe that there's an issue, so I'm hopeful that that there won't be any issues, but just mentioning. That's my advocate side.
I know for
coming out.
parents, they have a lot of it. So
I'm
you
sorry?
said for family reimbursement and for parent training,
So
you were saying something
the
about
kinds of
parent
things
training and
that are
family
not
reimbursement?
waiverized. That are not,
Right.
this
Okay.
kind of
There's
thing
another
that
person we can ask.
Right. And
Bill,
when I
Cliff
asked last
Beatty.
time, they wanted me to give them specific examples. So this is a little better.
Yeah.
Hmm?
Yeah.
You know what? Email the actual, like, see, and also the reason I'm talking about Cliff Beatty, he's charged of the ACS, Developmental Disability Unit. He may be able to know too. And now I see Christopher. Just unmute, Christopher. I see it. I see your hand up.
Hi. There is a
Hi.
question that Jennifer, you need to be alert on because I just got this today as I was at the press conference. I didn't want to say it there because it was getting windy, but now it's not windy where I am right now because now I'm at the World Trade Center area. There is a lot of people complaining about the fair fares in the low-income / disability community about if their car got damaged or lost and stolen, they have to wait for over a year or a month or two. They have been complaining this to their elected officials, but I also told them to contact 311 to also put as a complaint. What is any new procedure we should know about the fair fares?
No, it shouldn't take that long, but I'm going to be quite honest with you. Two things. If somebody has a disability, they shouldn't be using a fair fares card. They should be using the reduced Metro card. So that has nothing to do with us if it's the reduced Metro card. For fair fares, if you have a disability, the only reason you should be involved with fair fares is through Access-a-Ride. And if that's the issue, it's not really based on the card, it's based on your eligibility, and that's all done electronically. So I'm not sure that this was clear, but if there is a case that you want to reach out to me about, I'm happy to look into it and see what the situation is.
If I get that family, I will tell them, I'll forward it to you when I get it. But right
Great.
now, I'll believe it when I see it. But it's just brought to my attention the last couple of days. So
Yeah,
if I
I'm
get any
happy to. I'm
information,
happy to look into any of those things. It usually does not take so long to get a replacement card. So, yeah, but what you're saying there doesn't quite jibe with what people are supposed to be doing. Yeah.
thank you, Jennifer, and everyone. Enjoy your Thanksgiving. I'm on my way now to the Port Authority meeting, so I'm not far from you, Jen.
Yeah.
Yeah, Chris, tell Commissioner O'Toole, I'm not coming.
We already know that already. And by the way, guys, earlier when you saw people, you did have a little more attendance, Jennifer. So your number there is not correct. You had additional, you had 17, make that 27. A lot of people were listening your presentation earlier
Okay, that's fine.
in the Park Slope community.
Okay.
Wow,
Wonderful.
thank you. All right. Bye, Chris. Okay, but going back to what Doris was saying, Robin, we'll need to work on this. Are you there, Robin? Oh, there she is. Sorry, Robin. We'll need to ask questions, but you know what, Jennifer, if you can
Why don't you? I don't know
email.
why you don't see me.
I don't see.
I'm going to be honest. I have meetings with the.
Oh, you know what? You know what it is? I'm logged into my remote. I'm logged in remotely, so it's showing my office computer.
Okay,
I'm
nice
working
office.
remotely, not my camera from here. Yeah, it's a mess. So yes, I will follow up with Nick and Amy to see if we can get those type of services to the people living in shelters. You said parent training, family reimbursement, and sports and recreation tickets. I don't see why not, but I don't know. People have certain regulations that I might not be
I'm
aware
pretty
about.
sure it's okay.
But I'll get back to you, Deborah, and Jennifer. Jennifer, what are you from an agency? I'm sorry, I don't think we've met before.
Oh, I'm from the Department of Social Services, and I support both HRA and DHS in serving people with disabilities. We're actually on regular calls with OPWD about cases, and there have been opportunities to get even some people waiver services in shelter. But our understanding in those meetings is that the family support services are available. But it's good for everybody to know and for you to follow up with that. And Doris, if I have people that come to our attention, I'll get them to you. we've got a lot of cases of people with developmental disabilities in shelter. I'm going to be very, very honest. An enormous number of people, both in single adults and adult families and in families with children, number of kids with autism in shelter. And I want to make sure they get as many benefits as possible to support them.
Okay. As long as they're OPWD eligible, they should be able to get these services.
Yep. Thank you.
Yeah, it is important, Robin, because a lot of the families need just a little bit of happiness and joy, whatever they can get, because it's rough to probably be in shelter. Maybe it's better,
Right.
but because they have some family type shelters now. But whatever we can find out. I'm also going to reach out to Cliff Davies because he worked with the ACS Developmental Disability Unit. Jennifer, do you and Cliff ever talk?
All the time.
Bug him.
We have
Ask him.
emails back and forth about cases all the time.
Bug him. Ask him.
Yeah.
He should know that too.
Yeah.
You can quote that I said it. Don't, because he'll say, "Oh, Chris did it," and they'll say,
Yeah.
"Deborah did it."
Yeah.
Okay.
Okay.
That I take very seriously. Robin, do you have any updates with anything for OPWDD? I brought up about the next week statewide on the 30th, and the Manhattan location is going to be. We're going to be at the Center for Family Support at 337th Avenue. Do you have any other updates, Robin? If not, either way, do you have anything?
No, I don't have any updates at this time. I would be, usually the administration would have the OPWD updates. I don't know if anybody's on this call other than me.
Delia was on before.
Yeah, Delia was on,
Oh,
and
okay.
Angela Blake is on. So that's the
Right.
only
So
thing I
Delia
know.
would have
She
more
popped in,
OPWD.
popped out.
Yeah. Oh, okay. No,
All right,
they
well-
don't give me the updates. Usually it's the deputy directors or the administration usually provides the updates. I'm not either.
Okay, but I still appreciate you popped in, like I appreciate Angela Blake popped in. So before we leave, does anybody else have any questions for Robin and for Jennifer or Elizabeth or me? Okay, I'll give everybody. If anybody does. If not, we can end the meeting early.
Happy Thanksgiving, everyone.
Right. I want to wish everybody a happy and healthy Thanksgiving.
Happy
And may
Thanksgiving.
everyone enjoy it with their families and their loved ones. Thank you. And
Bye-bye.
again, I thank my two speakers. We all need to thank you. I'm only going to clap like this because of my tendonitis. Thank you.
Thank you for
Excellent
having us.
presentations. Thank you for your help. Thank you.
Thank you.
Happy Thanksgiving.
Happy
Thanksgiving.
Oh, there
Happy
you
Thanksgiving,
were.
everyone.
Nick from
Happy
PhD.
Thanksgiving.
Thank you, everyone. Okay, here it goes. I'm having fun watching this go. Mhm. 1, 2, 3. Let's see. Okay, now it's frozen. Instances.